There is a specific kind of silence that falls over a hospital room when the doctor stops talking about medicine and starts talking about paperwork. It's a heavy, suffocating silence. It's the moment you realize that the thing threatening your life, or the life of someone you love, isn't just the disease. It's something else. Something vast, invisible, and incredibly cold. For generations, we were told a story about safety. We were told that if we worked hard and paid our premiums, those monthly tithes sent off to glass towers in distant cities, that when the worst happened, we would be caught. We bought into the idea of insurance as a community safety net, woven from our shared resources. But somewhere along the line, the weavers of that net realized there was much more money to be made in letting people fall through it. In December of 2025, the illusion finally shattered. The catalyst was violent, a shocking act on a midtown Manhattan sidewalk that took the life of a healthcare CEO. But what followed that act was perhaps even more disturbing. It was a lack of surprise, a collective, grim nod from a public that had been pushed past its breaking point. To understand why, we have to understand that we aren't fighting people anymore. We are fighting an architecture of denial that has been perfectly optimized to extract maximum profit from human vulnerability. For years, the strategy was simple bureaucracy. Understaff the call centers, lose the faxes, require forms that don't exist. They made the process of getting care so exhausting that the sick simply gave up. They weaponized fatigue. But fatigue wasn't efficient enough. The profits were billions, but they wanted more. And to get more, they needed to remove the last remaining obstacle in the denial process: the human conscience. If you place a doctor in front of a patient, an 85-year-old woman who broke her hip and needs 2 more weeks of physical therapy to walk again, that doctor, being human, will likely approve the care. Empathy is expensive. So, the industry began replacing doctors with algorithms. They gave these programs innocuous names, like NH Predict. They sounded scientific. They were marketed as tools to guide care. But in practice, they were engines of rejection. These systems didn't see a grandmother trying to return home. They saw a data point that was deviating from an average. The AI would calculate the statistical average recovery time for a hip fracture, and on day 14, regardless of her actual condition, it would cut off funding. The results were staggering. Profits for companies like UnitedHealth Group soared, nearly doubling in just a few years to $16 billion. But the other side of that ledger was devastating. We started hearing stories that seemed impossible in a civilized society. Stories of medical directors at insurers like Cigna, who weren't even opening patient files. They were sitting at computers, clicking deny on batches of claims, spending an average of 1.2 seconds on each human life. 1.2 seconds. That's not enough time to read a diagnosis, let alone understand a person's pain. It is only enough time to click a button that saves a corporation money. They knew these machines were flawed. There were reports that when families had the energy to fight back, to navigate the labyrinth of appeals, human reviewers overturned the AI's decision up to 90% of the time. 90%. Think about what that number means. It means the initial denial was almost certainly wrong. It means the system was operating with a margin of error that would be unacceptable in selling toaster ovens, let alone managing chemotherapy. But they kept using the machines. Why? Because they knew that for every person who fought back, 10 others would be too sick, too tired, or too confused to try. They were banking on our exhaustion. The cruelty of the friction was the point. And this is where the tragedy lies. It's not just in the bankrupted families or the untreated illnesses. It's in the profound moral injury done to an entire society. We were forced to watch as the very instruments meant to heal us were weaponized against us. When that CEO was killed in New York, the strange muted reaction from the public wasn't an endorsement of violence. It was a murmur of recognition. Millions of people looked at that headline and didn't see a business leader. They saw the face of the system that had denied their mother her rehab or their child his medication. They saw the embodiment of the algorithm that had told them no when they were at their absolute weakest. We are now living in the aftermath of that realization. We are looking at a system that has successfully monetized the act of withholding care. It is a vast, highly efficient machine designed to convert human suffering into shareholder value, untouched by human hands, processing our pain in 1.2-second intervals. And the most terrifying question isn't how much money they are making. It's what happens to a society when its safety net is replaced by a predator.